Welcome everybody to another week of ozone therapy expert interviews. This week we talked with Dr. David Minkoff on the subject of Lyme disease, metal toxicity, some of the myths and facts about supplementation in the market, and of course, ozone therapy. I think it was a really great interview for a number of reasons, because we talked about metal toxicity and some of the chelators, how they can take heavy metals from areas like your bone and displace them in the heart, and you really don't want that to happen because it'll just make it worse. So we talked about some of the things you can do for that. We talked about Lyme disease, one of the great mimickers, and one of the most complex diseases we have today, and who better to fight it than Dr. David Minkoff, who has an extensive experience in fighting some of the most complex diseases on the planet. So take a look if you're interested in Lyme disease, ozone therapy, metal toxicity, and supplementation, because this is going to be a great interview. There was some things I did leave on the table with this interview. I will admit that, because there was just so much information that we could have gone down. We could have had so many different rabbit holes, and I could have gotten way more out of it. But if you have some specific questions, post those in the comments below, because I'll send them off to Dr. Minkoff once I get a number of them, and maybe, just maybe, he'll respond to them. So please post those in the comments below. And without further ado, I give you Dr. David Minkoff. Dr. Minkoff, I just wanted to say thank you very much for taking the time to talk with us today. I'm really excited to go into Lyme disease and some of the myths about the supplements that are out there on the market. I know you have an extensive experience in infectious disease, and that's kind of where you got your start, or at least was a big part of it. So what caused you to look into complementary or natural medicine?
Well, I actually got into it by necessity. I was in the middle of an emergency medicine career. I started out in pediatrics and infectious disease, and then I switched over to emergency medicine. And my wife was pursuing health and alternative health, way beyond anything that I was interested in. And she decided that when she learned about mercury, that she should have the mercury removed from her teeth. And so she went to a dentist who wasn't really qualified to do it, and she had 10 amalgam fillings, all of her major molar teeth, and he drilled it out with no protection. And a few months later, she started to have different kinds of symptoms, like autoimmune type problems, thyroiditis, hepatitis, and then eventually it got to the point where she couldn't lift up her arm, and she couldn't move her leg to the side, because now she had what the neurologist was thinking was something like MS. And what they were suggesting at the time, and I was a hospital-based doctor in an emergency room, and I knew all the good doctors, and they'd all seen her, and they didn't really have much of a suggestion of really what was going on or how to handle it. And now with the potential MS, they were talking about steroids and interferon and big time drugs. Now, my wife is a very good athlete. She's a triathlete, and she's a nurse, and she's always been nutritionally oriented. And so this didn't make any sense to me. And she owns a home healthcare nursing business, and I went to pick her up one night, and there had been a new dentist that had moved into that complex where she was, and on the marquee it said natural dentistry. And it so happened he was walking out to his car that night, and I stopped him and I told him the story, introduced myself and told him the story. And my first question to him was, what is natural dentistry? And he said, well, we believe differently than the average dentist in that the mouth is actually part of the body, and that you wouldn't do things or put things in the mouth that you wouldn't do in any other part of the body. Now, no self-respecting doctor since the 1800s would give someone mercury as a remedy.
Yeah, they used to use that to treat everything.
What's that?
They used to use that to treat so much, and like syphilis, and yeah, just take a mercury pill and let's.
Just kill me. I think Mozart and a bunch of people died from being just basically being poisoned. So and nobody would ever would leave in a dead organ. You'd never leave a dead appendix or a dead gangrenous toe, and yet dentists commonly do those things. The root canal tooth is a dead infected organ. So he said, well, we don't do that. We see the mouth as part of the body, and you have to do the thing, things in the mouth to correct it that are compatible. So I said, well, that sounds like a good idea. So he said, I'm sure your wife is mercury poisoned, because if you take a high-speed drill and you drill out mercury, the mercury at room temperature is a liquid, but at 110 degrees, it's a gas.
Mm-hmm.
And so you get this high-speed drill and you aerosolize these particles, and they go all over the place. They go in the throat, in the mouth, they're swallowed. They can attach to nerve endings. They can be transported to the brain. And he said, I'm sure that's what's wrong with her, because it affected her thyroid and her liver and her central nervous system, but she's mercury toxic. But there's no one in this town, this is 1995, who knows anything about this, and you better go to get some instruction in this. There's a doctor in Seattle, and he teaches doctors, and he will tell you what to do. And so I quickly found one of these courses and went and got educated and came back and did the testing on her and found out, yes, she was mercury toxic, and how to handle it. And I handled it, and within a few months, she was fine. And we had a whole bunch of friends who were sort of watching this process. And they said, well, I've got chronic migraine headaches, and I've got rheumatoid arthritis, and I've got, colitis. Can you help me? And so the emergency room business it's a shift work. So I was working 12-hour shifts, either 7 in the morning to 7 at night, or 7 at night to 7 in the morning. Usually it's 3, sometimes 4 shifts a week. And I had a couple extra days, and she happened to have an extra room in her nursing office. And I set up a little clinic, and I had people come in, and my off days I was just playing and learning. And people started to get better. And the emergency room business became a drug seekers clinic. And the thing that sort of tipped it over the top was a little 5-year-old that was brought in by a 300-pound police officer in handcuffs because he had done something in school which the teacher didn't like. And I had to do a psych screening for him because he was going to be involuntarily admitted to the hospital. And he's a little 6-year-old, maybe 60-pound kid. And when his mother came, I sat down with her and I said, gee whiz, this is kind of not the right thing. I think you should take him home and get him some good food and put him to bed. And, there's got to be a better way. And she said to me, there's no way. He's going in the hospital. I don't want to deal with him. And then for me, emergency medicine became like, this isn't the right thing for me. And I switched over, and my wife and I opened up this clinic, and we've been doing it ever since. Part of the treatment that we used for my wife with her mercury, I developed with a biochemist, and it was a product which we later called metal-free, because it was a really good way to detoxify heavy metals very safely. And the unique thing about this product is that it doesn't bind good metal, good minerals. The problem with most chelators is they bind calcium or zinc better than they bind mercury or lead. So you're going to be pulling from the body while you're trying to get the bad stuff out. You're going to take out a lot of good stuff. And the unique thing about metal-free is it doesn't do that. It binds heavy metals, but it doesn't bind the good ones. And so I started a company because doctors started wanting to find out what had I done and where could they get it. So we started this company called Body Health, which now we have about 17 or 18 products, and most of our customers are doctors who want just high quality products to treat their patients with.
Well, that's phenomenal. I'm actually drinking some of the perfect aminos right now, but I didn't realize, so at the time of your wife being sick, you were actually already starting to formulate products for metal toxicity?
No, I had gone to ACAM and learned about chelation and IV chelation, and about DMPS and EDTA. And then when I started using it on people, I found that a lot of them would get back pain, and their kidneys were being affected. And that the right way to detoxify heavy metals is through the gut, not through the kidney. But most of these chelators go through the kidney, and you can cause kidney problems. So I met this researcher, biochemist, and I was talking about it with him, and he said, well, let's work together and we can formulate something where the target is, It will bind all the heavy metals, including aluminum, which isn't really a heavy metal. It won't take good minerals out. It will be 100%. The way the body will eliminate it will be through the gut, and it won't affect the kidneys. And it was a liquid. It's a spray. It's a sublingual spray, so that you can dose modify it very easily, so that you can start people on very low doses, and as their tolerance builds up, you can give them more. And so she was really the first guinea pig for that, and it worked really well with her. She was able to detoxify successfully, actually quite quickly, and her neuropathy went away, and her thyroid healed, and her liver healed. And then I would be at meetings and I would talk to people about this, that we had formulated this stuff, and other people got interested. So now we have many hundreds of physicians and chiropractors and health practitioners who use it, because the product is more than 20 years tested, no deaths, no side effects, very safe, and really works. So that's sort of how that got started.
And not to get too far into metal toxicity, one of the things I was struggling when I was researching you is that you have so many topics that you just can go so far into that I'm like, well, how do we not turn this into a 6-hour conversation about, just all the different topics? But one of the things I've heard, and I don't know much about metal toxicity and the supplements to detox them, so I know a little bit about some decalation and how Gary Gordon was involved with that, but I've heard that people talk about these sprays and different things that you can take, or these different chelators that you can put into the body, but they just kind of stir up the toxins and don't actually bind it and draw it out. Is there truth to that? And if so, how does your product work with it?
Well, there is truth to it. And, the chelator, the thing that's going to bind the metal, has to bind to the metal from where it's sitting at wherever it's sitting. If you eat some tuna and it's got a lot of mercury in it, that mercury will stay in your bloodstream for maybe a month or two, but then it will be put somewhere by your body. It will be bound onto some other tissue somewhere, either in the interstitial space or in the cell or on the surface of the cell. And if you then, or in your bones, and if you put a chelator in and you bind it, if the binding attachment, the affinity between the chelator and the heavy metal isn't really good, sometimes what happens is that you will pull lead out of someone's bones and drop it off in their heart or their brain, and you actually can make them worse that way. So metal-free has a cage-like structure which completely engulfs the heavy metal, and the bond is very tight. It's both an ionic and a covalent bond. Those are different ways that things bind, but it's very tight, and it won't let go of it. So that makes it very safe. It is taken out of the body by the liver. It's put into the bile. It's put into the intestine, and then it goes out. I have had patients where they were given chelators and where they actually got more symptoms or worse because the metals went from one place to another. The other important thing about this is that if the body isn't ready to handle another toxin, because most people who are toxic have a lot of other stuff going on too. They have other chemicals. They have nutritional deficiencies. They've got a liver that's already overloaded with lots of stuff, and it's not going to take a new heavy metal and get rid of it. It's going to say, sorry, I'm overloaded. I can't take you. And now that thing is going to go somewhere else. So I think it's really important where doctors, yes, you do a heavy metal test, and yes, the person has heavy metals, but if their mineral balance isn't good, if their hormone balance isn't good, if their gut isn't fixed, if their amino acid levels aren't good, they're not going to detoxify metals very well, and you might make them sick. So in our clinic, the way we do it, metals actually are a late phase in the handling of the patient, not an early phase. Because unless you get these other things fixed, you put the patient at risk.
Yeah, and that's kind of a scary thought, that you can actually stimulate yourself into worse symptoms by just using the wrong product or supplement or the wrong chelator that can make
Right.
things worse. So, and to my understanding, what you're saying your product does is that actually binds with the metal, and then your body is able to recognize, oh, this is something that needs to be discarded, not replaced or redistributed throughout the body.
Right. And not through the kidney, because the anatomy of the kidney is very delicate. And when you start putting free radical heavy metals through the kidney, you can get problems. The bowel is made for lots of free radical reactions. That's what's going on in the intestine. There is lots of huge chemical reactions going on there. And that's how you're supposed to detoxify heavy metals. And chelators that don't put it through the gut, but put it through the urine, again, those aren't the optimum thing to do.
And so to make a little bit of a transition here into Lyme disease, I know that they are real. A lot of the symptoms kind of play off each other, like metal toxicity and Lyme disease, at least from more of a superficial view, the symptoms can look pretty similar. So how do you differentiate between those two issues going on?
Well, Lyme is one of these great masqueraders. Patients with Lyme can have arthritis. They can have brain fog. They can have kidney issues. They can have autoimmune issues. They can have memory loss. They can have depression. And it could all be underlying Lyme. What we find with Lyme disease patients is that usually Lyme is there as a secondary problem, not a primary problem. Most of the people that we see, and we see patients really from all over the world who come with Lyme, that most of these patients haven't ever had a bullseye rash. They never had an acute syndrome with a tick bite. They may have had a history of years or tens of years earlier where they knew they had tick bites but never had a problem with it. And now they're presenting with rheumatoid arthritis or MS or Parkinson's disease or chronic fatigue. And as a part of their problem, they have active Lyme disease. They've always got other issues at the same time, which have to be dealt with, because like ILADS doctors or doctors who are treating Lyme disease with antibiotics, the treatment is very, very unsuccessful in most patients.
Mm-hmm.
Whereas if you can get the patient restored health-wise, some of the things I talked about before, mineral balance, amino acid balance, handling viruses, handling their gut, handling their infected root canal teeth, that you can get the person's immune system to be good enough that then when you start to treat Lyme with non-pharmaceutical approaches, people actually get better. And over a course of 2 to 3, 4 months, maybe at the longest 6 months, about 85% of the patients that we see, they get better. They go home, they're fine, they don't have chronic Lyme disease, they're not on chronic medicines, and they actually get over it. It's because they've had a whole health restoration, not just, okay, we're going to give you 5 antibiotics for the next 20 years, and hopefully we're going to catch all these bugs that are part of the Lyme complex, and you'll be fine. It just doesn't work out, hardly ever.
And you have a long history of working with pretty complex diseases, so one could say you have an affinity for difficult problem solving.
Well, I like it. I think it's fun, and the most fun is giving people hope. The average person coming to our clinic has seen 13 doctors. Now, these guys aren't stupid. They're all well educated, but their view on what causes illness and how to handle it tends to be extremely limited. And so I've just had to keep expanding my own knowledge base and my own repertoire, because anyone who's chronically ill has a problem that hasn't been discovered by the doctor that needs to be discovered and handled before the person can get better. And so it's pretty much a Sherlock Holmes type thing of, okay, what don't I know? What is at the bottom of this? What do I need to find to solve this case? And then when you do it, you see boom, 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 boom. They start to get better.
What are some of the different ways that Lyme disease is transmitted? And does the different transmission method make a difference in the Lyme disease?
It's originally it was said that it was caused by a certain particular kind of tick, and it was restricted to certain geographic areas. And I think what we found since then is that none of that is true. I think any biting insect can transmit the disease, whether it's a tick or a flea or a mosquito or a bed bug. If that particular insect bit someone else where they had Lyme in their bloodstream, or an animal that had it in their bloodstream, I think that it is potentially transmissible to a human. I think most people who get infected don't actually get a bullseye rash or a flu syndrome or anything like that. I think when that happens, that makes it easier, because in that case, they can be treated with antibiotics, usually successfully, and they can get better. But most of the people we see haven't. Now, this is a worldwide, I think, epidemic at this point.
Mm-hmm.
You know, we see patients from Australia and Finland and Germany and Hawaii and China who come because they contracted Lyme where they are. You know, infectious disease, I was an infectious disease doctor, and if you look at sort of infectious disease over time in history, you see that there are epidemics and then the disease goes away. And I think right now we are in a pandemic of Lyme disease, and many people have it. Many people aren't diagnosed with it. I think the traditional diagnostics from LabCorp or Quest or these other laboratories, where they've set a criteria, or the Centers for Disease Control, they have set a criteria for diagnosis of the disease, which usually isn't present in the person that has Lyme. Lyme is probably the most sophisticated bacteria ever discovered.
Mm-hmm.
Bacteria bacteria, when they're near each other, they can trade information. They can trade resistance factors. And these resistance factors, you know, so you give someone who's got a urinary tract infection with a big load of bacteria an antibiotic. And some of those bacteria will be resistant to that antibiotic, and they are able to transfer that little piece of information, it's called a plasmid, from themselves to another bacteria who will then become resistant. Well, the average bacteria has maybe 3 or 4 of these plasmid factors where they have information that protects them. Lyme disease has 23 plasmids. No bacteria that I know of has ever had that many. So they can do a lot of things to hide, to change their shape, to cover their skin, so to speak, so they're not noticed, to take different forms, to go dormant, and so and to disable our own immune system, to put toxins into our immune system so that it doesn't either recognize them or go against them. So it makes it a big challenge when first the routine methods of diagnosis don't work, and then you have lots of doctors saying, well, you don't have it because the test wasn't true, when that really isn't the situation. You need laboratories that have the sophistication to find the Lyme in these different forms, and to then show you that that's what you've got, so that you can actually know what you're treating.
So if there's somebody out there that's suspicious they have Lyme disease, is there something they can do to potentially diagnose it or figure out what's going on?
Well, if they go to their doctor and they get the usual Lyme test and it's positive, well, then that's great. But if they have symptoms that could be Lyme, or they're suspected, or they've seen a lot of doctors and nobody's making sense of what they've got, and what happens with most doctors is they do a physical exam, it looks okay. They do some basic blood work and it looks okay. They do a Lyme test and it looks okay. But you have a person who is tired, who can't think, who's depressed, who's got no energy, who's having trouble working, and the doctor who does those sort of routine things and then says, oh, you're just a menopausal woman who's depressed and you need Prozac, that never will solve the problem. That never fixes the thing, and it's wrong. And if you've been in that situation, you need to find a practitioner who's an experienced Lyme doctor who can do the diagnostics on you so that you can find out what you have, and then you can get proper treatment so that you can actually get better, which you can in people who know what they're doing and who do it right. And in people with chronic Lyme, it's never antibiotic after antibiotic after antibiotic after antibiotic. It just doesn't work in my experience in most people.
Mm-hmm. And for people watching, if you're interested in seeing Dr. Minkoff, you're in Tampa, right? Or is it Clearwater?
We're Clearwater, yeah.
Yeah, Clearwater, Florida, LifeWorks Wellness Center. So he's one of the Lyme experts. People from all over the world are actually coming to see you for Lyme disease. So you're kind of one of the recognized guys in that circle. So it sounds like to get a good diagnosis for Lyme disease, though, you really do need to see a practitioner that knows what's what.
Absolutely.
Okay.
And unfortunately, most doctors who do infectious disease aren't in that category.
And another question I have is, you mentioned earlier, kind of one of the typical routes of working with Lyme disease is doxycycline or other antibiotics. And those are, you said that they don't have very good efficacy rates. So how do those affect Lyme disease? What kind of efficacy rates do they have? Are they at all effective?
Well, if someone's got an acute bite, they're good. That's what I would use. But if someone's down the line and they have a chronic illness, the problem with trying to treat with an antibiotic is that these Lymes can hide inside of cells. They produce biofilms which protect them from the antibiotic even getting in. They have all these resistance factors, so they can be resistant to one or more antibiotics. So if you're trying to do it that way, and most of the time, the host, the person with the disease, has a lot of other things going on which are compromising their immune system so that it can't fight the Lyme anyway. There's a laboratory that did they have a test which is really sensitive. Like what they told me was that if you have 10 Lyme organisms, now Lyme is a bacteria that's about as big as it's a micron or two. They're teeny. And if you, so their test was so sensitive that they could pick up as few as 10 organisms in a person. So what they did is they went to the street, they took 100 people off the street who had no known illness. They gave them a little stipend for being a guinea pig. They did a Rolfing massage on them. So they massaged them very hard to try to stir up any Lyme that might be hiding. Now, these are asymptomatic people. And then they collected a urine and they sent the test for Lyme. And they found that 90 out of 100 people were positive tests for Lyme. But these people weren't sick. So what that says is a lot of people are walking around with it with no symptoms, just like they're walking around with a dormant herpes virus of some kind, or a dormant chlamydia bacteria of some kind. But if the immune system now gets tied up with parasites, other viruses, super stress, overexercise, infected teeth, other things, and the immune system then goes down or has to be mobilized towards some other major target, then these Lyme guys, they wake up and they start to produce problems. That's why if you're just trying to treat the Lyme without handling the other things, in my experience, you're rarely successful.
Yeah, and that's one of the big aspects of natural medicine or holistic medicine. You're looking at the whole system. Lyme disease isn't just kind of one aspect, one treatment type thing. So for people, if 90% of people, let's just assume that it's 90%, it may or may not be, but have some form of Lyme disease, what can they do to prevent kind of that overload to where they actually start getting symptoms?
Well, live clean, eat an organic diet, avoid chemicals and pesticides, get enough sleep, manage your stress, get some sunshine every day, do some exercise, do something that you love, figure out some way where you can help other people do something. These are sort of the very basic things that if you're doing them immune-wise, you're going to be better. Take supplements. Most of us now, the food is of such poor quality and availability of quality that almost everybody needs supplements. You need to have extra things. When we measure, like you were talking about perfect amino, when we measure levels of amino acids in people's blood, now this is everything from very high-end athletes to people who have cancer or people who have chronic illness. they are virtually all deficient in amino acids, and especially in essential amino acids. And so this product that we have called Perfect Amino, we give it to all of them, because if you don't have enough amino acids, so amino acids are the basis of your immune system, neurotransmitters, most of your hormones, most of your barrier tissues, all of your detoxification system. So if you're deficient in these things, you're not going to have those things working, and you're going to be susceptible. So so it's not the only nutrient that you need, but you need a lot of different things, and you have to measure these things to make sure you've got enough omega-3s, you've got enough zinc and selenium and magnesium and potassium and copper and these sorts of things, and that you have a gut that's not full of parasites and yeast and blah, blah, blah. Then you can actually get somebody well, and if they're borderline on their Lyme symptoms, they may get better just doing that. The other thing is what we find in our clinic, and you've been big supporters of us in this, is that ozone is probably the universally best, safest treatment, no matter whether you're well or sick. And Simply O3, we send everybody home with an ozone machine, because ozone makes bodies better. It makes athletes faster. It makes tired people, gives them more energy, because as a chemical, as oxygen to the third power, it can do many beautiful things in a body to help it to stay well or get it well if it's not well.
And I know ozone has been one of the big tools you've used in your clinic, at least for the past, I don't know how long. Has it been a decade yet that you've been using ozone?
Almost.
Okay.
Almost.
So we've been using it for a while now. What are some of the actions of ozone therapy? I guess before we get into what are people experiencing with it, what are some of the actions? What's it actually doing in the body that's benefiting people?
Well, ozone it's triplet oxygen. It's a charged molecule. And when you put it into the body, whether it's into a joint or into the bloodstream or into ears or into rectums, you can use it just about anywhere. What it does is it has several sort of major effects. It's an immune booster. It will bind to chemical free radical toxins. It will enhance mitochondrial functions. So all sick people have sick mitochondria. Their mitochondria aren't producing enough energy for them to stay well. And ozone will convert the ratio in the mitochondria of the major thing that it needs to produce energy. It's something called NADH. It's vitamin B3, to an active form from an inactive form, which allows cells to produce energy so that they can then detoxify. So these are the major things that occur when you put ozone in someone. Now, if they're healthy and they're an athlete, they can do more. They can do it faster. If it's someone who's sick, it will help them reduce the load of the organisms that are circulating around their system, because when it hits a bacteria or a fungus or a parasite, it will kill it. Our bodies have an enzyme on the surface of our cells which don't allow the ozone to be toxic to us. It's a peroxidase, and it allows us protection from ozone. But bacteria and parasites and funguses don't have these peroxidases, and when it hits their cell membrane, it kills them. And it's very interesting. It's very potent. Like if you took 4,500 bacteria and you put 4,500 units of chlorine bleach in with the bacteria, it would take 30 to 45 minutes for the chlorine to kill the bacteria. If you put one molecule of ozone in with 4,500 bacteria, it will kill them within seconds. So it's very powerful. And yet for our own bodies, it's not dangerous in the hands of people who know how to do it. So it's a remarkable discovery. It's a remarkable treatment, and it really is. We couldn't practice without it.
Yeah, it's really quite an interesting paradox that ozone, a very strong oxidant, actually can stimulate a beneficial result within the body. And it does a lot of different things, like you were saying, athletics, to chronic disease, to preventative care, to joints, just all sorts of things that are going on. And speaking of athletics, you just did another Ironman, didn't you?
Yeah, I just finished my 43rd Ironman triathlon.
Yeah, that's wild. So how has Ozone helped you with maybe doing some of those Ironmans?
Well, it's interesting because before I started using Ozone, I went and did the course on Ozone. And I've been doing triathlons for 35 years. So I have a very good log of what my abilities are running and biking and swimming. And so at the time that I did the test, I did a sort of a VO2 max test, or a lactic acid, actually it was a lactic acid threshold test on a bicycle. So I was riding at my lactic acid threshold. That was 9 years ago.
Hmm.
And the bike tells me how many watts of energy I'm producing. And my lactic acid threshold was 162 beats per minute, heartbeat. And so threshold is just under that. So I was exercising at 158 heartbeat, and I was pushing 200 watts on the bicycle. So for my weight and my size, that means I'm riding between 20 and 21 miles an hour. And I could do that for 5-6 hours. I go harder than that, I would exceed my threshold. I would start to get burning in my muscles, and I would have to slow down, or out of breath, and I would have to slow down.
Hmm.
So I then did 10 IV major autohemotherapy treatments, 2 a week for 5 weeks. And I retested myself on the threshold test. And at 200 watts, my heartbeat was 158 pre-ozone. It was 138 after ozone.
That's a big
That
difference,
is a huge,
especially for somebody
difference.
that's been doing it as long as you.
That's right. For a fit person, that's huge. Now, so then what I did is I pushed up my effort so that I went back up to threshold. And instead of pushing 200 watts, I was pushing 215 watts. That is a lot of extra power on a bike. And in a race, that's a huge difference in time. So it's a performance enhancer. There isn't any doubt about it. And it can really help athletes with performance and recovery. And if you're an athlete and you're not doing ozone, you can believe that the guys that are beating you probably are.
Yeah, I know, especially a lot of cyclists. It's made its way into there, and it's starting to make its way into the NFL. I guess I can't really talk about it too much, but we're looking at working with some people in that, and hopefully getting it to some more players. So that'd be a really good thing, I think. So, what are the
I,
best ways to go ahead?
no, and I think if you combine ozone with perfect amino, because in terms of recovery of muscles, tendons, ligaments, this sort of thing, it's almost a magical combination, because the body needs amino acids in order to heal, increase lean body mass, increase detoxification. And when you put the two of those things together, the athletes call us all the time and they say, wow, 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 that combination really makes the difference.
Hmm. Yeah, and like I said, I've been using aminos for quite a while. I used to do athletic competitions and used it all the way throughout, and really have loved the product. It's great. So what are the best ways, though, to administer an ozone therapy? Because like you said, there's so many different ways to do it. There's the rectal insufflation and the major autohemotherapy, which are the two primary ways of doing it. What would be the best way out there?
In our clinic, the usual way we administer it is major autohemotherapy. So we take blood out, we add ozone, we put it back in. We do a lot of that, and then we do a lot of it where we're on the way back in, we're putting the blood through a UV light machine, and that adds a dimension to the ozone therapy. It adds these wavelengths of light which are immune activating. We get those machines from you guys, and that helps people a lot. We also put most people a couple times a week in an ozone sauna. It's a device called HOCAT, and they get a combination of steam plus ozone plus infrared light plus 100% oxygen, and that helps with detoxification through the skin, gives people energy. We do a lot of what's called prolozone, which is people come in with problems with joints or ligaments, tendons, muscles, pain, and so we're able to inject the ozone into those areas. It creates a healing response. About 80% of the people that we see that have had chronic back pain, neck pain, shoulder pain, knee pain, whatever it is, by 4 to 6 prolozone treatments, their pain will go away or be be significantly improved. So that's another way. In people with interstitial cystitis, we put it in their bladders. It can really help heal bladders up. So,
Really?
yeah. Also put it in the ears. If someone's coming down with a sinus infection, you can put the ozone in the ears. It goes across the tympanic membrane. It goes into the sinuses, and it can help with sinusitis to heal them up that way. So we do it in almost any body orifice. That you can't breathe ozone because it's very irritating to the lungs, but almost any place else, it works really well.
And you send people to do ozone therapy, or you refer people to do ozone therapy at home almost more than most practitioners that I know. Why do you have people do that, and what are some of the outcomes you see from it?
Well, usually, they'll come to our clinic with Lyme disease or cancer or chronic fatigue or something like that, and they may spend 2 to 4 months with us where they're getting intensive treatment every day. And then they reach a point where they're, hey, I'm doing really well, but I know that the bugs are still there. The cancer is still there, but they got to go home. And one of the things I find is that if I send them home with an ozone machine, simply O3 portable ozone machine that they can do rectal and ear ozone at home, and I say, just have them do it. Look, do this every day. It's easy. It takes about 5 minutes to do a rectal insufflation with ozone, and we teach them how to do it in the office, so they know how to do it, and they're able to get the oxygen where they live. And then I have them do it daily for about 3 months. They come back for a recheck. They're stable. They're doing well. We might cut them back to 3 days a week. On a maintenance, they might be doing it 1 or 2 days a week. But I do a maintenance myself of 1 day a week. I get an IV ozone treatment, if at all possible, at least every week. Keeps my immunity up, keeps my energy up, keeps my performance up. And so I think that people should do it, even if they're not sick.
What's going on, ozone nerds? I'm interrupting this show to tell you about ozone therapy at home. And you can actually get set up with ozone therapy at home, just like Dr. Minkoff was talking about. He uses it as a performance enhancer, as an optimization, as preventative care, and to treat the chronic diseases of the people in his clinic. He said it improves the patient outcomes. So if you're interested in this therapy at all, click the link below in the description of this video, and we will send you information on how to get set up, the oxygen tanks, what kind to get, where to get them, how to get them, all that kind of information that you need to know about ozone therapy at home. We will send that to you, and we're here for your support. So if you have any questions, you can always call, email, anything you need to do. At any rate, click the link below in the description of this video to learn more about getting set up with ozone therapy at home. People usually spend, it's a little bit of an initial cost, $750 up to $1,200 to get the equipment. But then once you get that, you're set to go indefinitely. It's a very inexpensive therapy over time, and the more you do it, the cheaper it becomes. It becomes cents on the dollar as to what you would spend anywhere else. Super cheap to do, super easy to do. Like he said, in under 5 minutes a day, or even less, you can actually do ozone therapy at home. And I personally have used it many times just as a performance enhancer. And personally, I noticed an increase in stamina, a reduction in brain fog, an increase in energy. And I'm a pretty healthy guy, so that's not necessarily something that everybody is going to experience, especially if they're sick. They might experience a lot of different things. But again, click the link below in the description of this video if you're interested in learning about ozone therapy at home, which Dr. Minkoff uses to improve patient outcomes. Or if you're a doctor, go ahead and click the link too, because there's valuable information for you there as well. Back to the show.
A couple of years ago, Dr. Schallenberger at the annual American Academy of Ozone Therapy meeting presented a paper where they gave people prophylactic ozone. These weren't people who were sick, but they had them do, I think it was 1 or 2 rectal insufflations per week. And they followed these people for, I think, 10 years. And what they found is that if those people got into a drastic health situation, they had a near fatal heart attack, car accident, they had their intestine burst, something which would have killed them, that the people who were doing prophylactic ozone had a survival level that was way better than the people who weren't doing anything. I forgot exactly what the numbers are, but it was significant. 50% of them lived where the other guys didn't, or something like that. So I think ozone is a good thing for healthy people, even on the front end. So in case you get in some kind of health trouble, you're going to be better off. Your immune system is sort of primed. It's going to be stronger, and it makes you healthier.
So if you had to go, pretending you went back to when you were working in infectious disease and working in the hospital, if you had to explain ozone to them today, how do you think your colleagues would receive it?
Well, I mean, now there's lots of papers written on ozone. It's just that American doctors aren't reading those papers because they're mostly European. Now with the American Academy of Ozone Therapy, there's a lot more work being done and a lot more guys that are publishing. And I think it's coming. I mean, I think, sometimes a guy has sepsis and they have a terrible infection and they need an IV antibiotic. But I know that if you give that IV antibiotic and at the same time you're giving them IV ozone, they're going to survive better. You're going to kill more bugs. You're going to protect their immune system. And I think that these things are cooperative therapies. They're not antagonistic therapies at all. Adding ozone to a program, like a post-heart attack, like ozone would be good. It helps healing. Post-op, name your catastrophic event. That I think in 20 years, probably hospitals are going to have ozone machines and people are going to use it because it helps. And I think the more that it's used, the more, it's been sort of suppressed, or it's been sort of undercover. But when you now open it up and you get lots of innovative, smart people who try to solve solutions, you get just more ways that you can use it and more benefit.
Yeah, and I think we're getting to a point where there's just so many different ways that it's being used, which is good because as long as they can demonstrate the results. But it would be really nice to see some standardization in how it's used. And I think it is, as I've been talking to people more and more and going through it, that it is a very viable therapy for the future and that it can help a ton of people where other things can't. So as you were getting into, perfect aminos and the amino acids and those types of things, and you said those are kind of a supplemental thing to your ozone therapy, when did you start to get into amino acids and how did you see those benefit your clinic?
Well, my whole medical history really is either me or my family had something wrong and we needed a better solution. So in the case of heavy metals, it was my wife. In the case of amino acids, it was me. So I do Ironman triathlons. I exercise a lot. I injured a hamstring and I could not get it to heal. And I had, I have access to everything. I can inject it, I can massage it, I could chiropractor it. I did everything I possibly could to get it to get better. But if I would go out to the track and I would try to run hard, I knew that if I persisted, I was going to injure myself. And I couldn't figure out a way how to get it better. And I had a friend who had a sample of some amino acids, and he said, hey, try these. Maybe these will help you. And I tried them for about 6 weeks. And all of a sudden, somewhere in that, probably 3 or 4 weeks into it, the hamstring, sort of the low-grade pain sensitivity went away. It's like, wow, I don't feel it anymore. And I went out to the track, and I did some hard runs, and my leg was fine. And that got me thinking about it, and I thought, gee, this is interesting. So I was, my diet was either deficient in amino acids, or my gut wasn't absorbing them, or, my proteins. And somehow delivering these essential amino acids in the particular blend that I was taking did something very unique. The other thing that happened is I gained about 8 or 9 pounds of lean body mass without my body looking any different. And when I realized that my bones were filling in, my muscles were filling in, I was getting my body into a condition where there had been backlogs of things that it wanted to repair or wanted to help, and it couldn't because it wasn't able to digest dietary proteins and absorb them to the extent that I needed. So that's how I got into it. And then I started experimenting with amino acids in my clinic, and I started measuring amino acid levels in all my patients. And I would send a blood test for serum amino acids. And what was amazing to me was, like, the very best athletes had deficiencies, and all the sick people had major deficiencies. And if I gave them, 10 grams a day of oral amino acids of this particular blend, which is Perfect Amino, that within a few months, their amino acid levels in their blood would come up into normal range. But more importantly, they would say, gee whiz, my fingernails are stronger, my energy's better, my sleep is better. I can tell the difference. If they were guys who were workout guys, my injuries have repaired. I'm building lean muscle mass. And that we were just getting amazing changes with it. So I wrote this up as an article in Triathlete magazine. And at that point, I got thousands of guys writing, like, where do we get this? And how do we get this? And so we put together this formulation called Perfect Amino. And so now there are, it's being used worldwide for athletes and by doctors for sick people, because it's a missing link in people getting better. I wrote a book, which is it's an Amazon bestseller, called The Search for the Perfect Protein. It's the story of the amino acids, and also of how these can be utilized by individuals themselves without needing a practitioner to really improve their health and their immunity, and I'm pretty sure their longevity.
What are some of the outcomes that you've seen that have been really good from this?
Well, like, most of the people that I'm seeing are people who are sick. They have severe chronic illness, cancer, autoimmune disease, Lyme, Parkinson's, Alzheimer's. 100% of them have low levels of amino acids in their blood. 100%. Almost all high-end athletes have amino acid deficiencies in their blood. Their levels are low. And I know that if the levels are low, they're not building or rebuilding their immune system, their neurotransmitters, their muscles, their soft tissue at a rate that they should be. And so we give it to them, because you can't get somebody better if you can't get those particular things better. And nutrition is a major part of it. And most of these people have guts that are not in good shape. And these amino acids are pre-digested, so that you don't have to have all the things you need to if you're going to digest some meat or some soybeans or some crab legs, where you need, it's a complex system of stomach acid and enzymes and pancreatic enzymes and intestinal membranes, where the Perfect Amino bypasses all that, so that stuff just goes basically right in their bloodstream. If you take it on an empty stomach in 23 minutes, we measure the amino acid levels in the blood go up. And what's very interesting about it is that they go up, but it doesn't raise the serum glucose, it doesn't raise insulin. So it doesn't act like most proteins. If you take 25 grams of whey protein and you measure your insulin blood sugar level, you're going to see a spike, because those things produce a glucose response, whereas Perfect Amino doesn't. So if people are doing a ketogenic diet or they're intermittent fasting, this will not alter your blood sugar or give you a blood sugar response, which is nice. You just get the effect of the amino acids, which is what you want.
Yeah, and I like the supplement a lot too, because it's kind of like ozone in that it's a very fundamental thing. Amino acids being the building blocks of the body, it needs those things to be able to do whatever it needs to do. So you're not really sending in a drug, or you're not really forcing the body to do something. You're only giving it the ability to do what it does better. I've seen the diagram before about how the amino acids that you guys create are actually have a 99% absorption, whereas most of the amino acids or the foods that you're going to take in might be 30% at best, or
It's
around
actually
that.
not. Yeah, it's not real. It's not absorption. Like, if you take whey protein, it's 100% absorbed. Your body will absorb it very well. What has to happen with amino acids is that the body has to be able to utilize them. Utilize means it's able to take them and make protein. And so if you take whey protein and you measure how well does the body utilize whey protein to make amino acids, only about 16% of the whey that you take gets translated into body protein. So it's not a very good source to produce body protein. Meat is about 33%, meat and fish. Eggs are about 48%. 48% of the amino acids that come from whole egg, the body can utilize to make protein. Perfect amino is completely unique compared to anything else ever developed, which is 99% of those amino acids get translated into body protein. So if your body needs to make protein to repair or replace or build, if you take perfect amino, 99% of what you're taking is going to actually end up as protein, and with virtually no calories. So if a person's calorie conscious, they can build lean body mass without having to get a lot of calories with it. I would just want to allude to something that one of our customers just did a test with a group of guys that he's a physical therapist, and he's got a following of people that he advises. And he did a very interesting experiment, which is to do a DEXA scan, which is so you can see how much lean body, how much body fat, and how much body water does a person have. And the measurements are quite precise. Mm-hmm. Then what he did is he had them all do a 5-day water fast, while at the same time as their only nutrient, taking 2 scoops of perfect amino powder, so that's 10 grams of amino acids, 4 times a day. They did it for 5 days. What he showed is that they gained 4 to 5 pounds of lean body mass, lost percentages of body fat. And it was astounding to both of us, if we're trying to understand this physiologically, how could that even happen? Because 40 grams of amino acids is only 16 calories. So you're virtually adding no calories, but the body, through autophagy, through the fasting, was breaking down cells, recycling nutrients, making lean body mass out of old stuff. We're also doing a very, very precise workout program during that time. And this is astounding. You can never, there's nothing else that would ever do this. So it's very unique. And if people haven't tried it, no matter whether they're healthy or not, this can make a big difference in people's health and performance.
Yeah, that's phenomenal. I'm going to have to give that a try the next time I do a 5-day fast.
Right.
I mean, that doesn't sound so bad, losing some body fat, putting on some lean muscle mass just by and working out a little bit. That sounds great. And for the people who are watching too, if you're interested in Dr. Minkoff's book, I actually have a copy. I need to read it yet, obviously, because I said absorption and not utilization. So I'm going to be going through that very soon here. But that's a good book. And you said it's available on Amazon?
Yeah, it's on Amazon.
Okay, awesome. And so if people are interested in getting some of these supplements and some of the different things that you've benefited people with, where can they find them?
For supplements, they should go to bodyhealth.com, BODYHEALTH.com. There's a lot of information on there. There's a lot of videos on all kinds of aspects of health and performance. If people are interested in seeing me or one of my associates in our clinic, they can go to lifeworkswellnesscenter.com, all one word, lifeworkswellnesscenter.com. There's a website there with, I think it's close to 1,000 pages of information on all kinds of things, what we do. They can call and have a consultation with one of our intake people and see if the clinic is the right fit for them. We do see people from all over the place, and our success rate is very good with people with chronic illness.
Well, that's awesome. I have a whole cabinet of body health products. So I have a cabinet that's stacked. Every time I go to a conference and you guys are there, I'm like, yep, we'll just get a box of this, a box of this. So I have a bunch of them, but they're great because I can hand them out to people as they need. But to bring us to a close, I have kind of a tough question for you. In a broad sense, circling back to Lyme disease, how do you think we will overcome Lyme disease, which you indicated is a pandemic, an issue that is so pervasive? How do we overcome that?
I think part of it is kind of enlightenment that there is a lot of it. what the average doctor is seeing, he needs to think of it very high up in his list of what could this be. And then I think for people who don't have expertise in it, that they then locate the people in their area where there are practitioners who are successfully treating Lyme, and that they shunt those patients to those places. This is a big problem, because there are many hundreds of thousands of people who are out of work, on disability, tying up tons of medical facilities because they haven't been diagnosed properly, and their doctors just aren't up on what is this disease and how is it handled. I think there's been medicine is slow, it's conservative, and if there's a sort of bottom line on most doctors, and this included me before I got into the thing with my wife, is that if a doctor doesn't know about it, he doesn't like it. That's the main attitude. I didn't learn about it in med school. They didn't teach it to me. The drug rep isn't talking to me about it. I didn't hear it at the latest American Cardiology meeting. And so if it would have been worthwhile or significant, I would have heard about it, and I didn't hear about it. And that means that it's just quackery. And you're wasting your time with vitamins because you're just making expensive urine. This whole attitude that's there. Now, I think times are changing, because parents or patients are a lot more open to solutions than doctors are. So I think if you have a significant illness, or you have a heart attack, or you break your leg, or you need a doctor for your appendix, or you need a cesarean section, well, modern medicine is brilliant. It's wonderful. It can save people. But if you're a person who has some chronic situation, you've seen a couple of doctors, they're not giving you solutions as to, this is what's wrong with you, and I have a treatment for you. If it's palliative treatments, it's like symptom treatments. It's like, let's block your immune system. Let's put you on steroids. Let's give you a trial of antibiotics. Let's, one of these things, that you then open up your eyes and you start looking around and you find practitioners, and they might be chiropractors or nutritionists or naturopaths or medical doctors or massage therapists or acupuncturists or oriental medicine doctors. I mean, all of these fields are doctors who are looking at bodies and problems with bodies with a different attitude, and with a treatment regimen that is by and large very safe, very non-harmful, and they can help you. And so I just be looking that way, because there are perils in modern medicine. A lot of people die every year at the hands of modern medicine. And I think patients are getting wiser faster, and that's helpful. And I think the other thing is, if you think you can be healthy without an organic food diet and watching out for chemicals and pesticides in your environment and in your home, and getting enough sleep and getting some sunshine and exercise, that you're deluding yourself. The bodies just can't do it. And so it's sort of that combination with right supplementation, with right lifestyle, people can actually be healthy, enjoy their life, and live a long time. Well, and avoid toxic medicine.
Yeah. I mean, it's crazy to think that you have to be cautious of medicine, but I mean, I guess it's always true in a sense. Even if they are a natural or alternative doctor, it's not perfect either. So regardless of where you're going, I think the important thing is that you're educated, that you understand what you're doing, that you're not just taking, whether it's you or a doctor at the hospital, you're not just taking their word for what's going on, that you're actually attempting to understand what's happening. And I think you gave us some really good, clear advice that applies to us all. Well, I want to thank you for joining us today, Dr. Minkoff. I really appreciated talking to you just about Lyme disease and some of the different things. I know there's just so many topics we could talk about. So I'm sure we'll be having future conversations and going over some more things. I mean, from the environmental toxicity to some of the dental stuff, I think is super interesting. And we didn't get into that today, but I'd love to have some more conversations about that in the future. But again, thank you so much. Thank you for taking the time, and I really appreciate it.
Thanks, Micah. It was a lot of fun.
What up, Ozone nerds? Ozone Knots, I guess, is my official title for you guys, because an Ozone Knot is one who is familiar with the therapeutic modalities of ozone therapy, who is pushing the frontier of ozone. And we're all in this together. We're trying to bring awareness around ozone therapy to improve people's lives, but also give them more information so they can be better informed about their health and what they can do to improve it. Because a lot of people are only given A, B, or C, and they're not aware of C, D, well, the other options. I just sounded like an idiot, but they're not aware of the other options out there. So if you know somebody that could benefit from this video, please share it with them. Please keep the comments, emails, and all other ways of correspondence with me coming. I really appreciate it. A lot of you have been reaching out, showing me different angles to things that I was unaware of. So it's been really enlightening, been really helpful, and I love interacting with you guys. So just keep them coming. The other thing I wanted to say is if you're interested in getting set up with ozone therapy at home or in the clinic, please just click the link below in the description of this video because we will send you all the information you need to know. I mean, we'll send it all to you. So what's your excuse? Why wouldn't you click the link in the description of this video? Because you're going to get all of that information. So if you're interested in getting set up with ozone therapy, just click the link below and we'll send you the information about getting set up with ozone therapy. It's great therapy used for a lot of different things. People are seeing benefits all around the world and it's growing. It's growing by a massive amount, and I'm really appreciative to be a part of this. So thank you, and until next time.